Hello, everyone, and thank you for joining us this afternoon. My name is Karen Brownlee, and I am the Adult Program Coordinator at the North Suburban YMCA in Northbrook, Illinois. Our YMCA hosts a variety of free programs for adults in our community, including social networking opportunities, donation drives, brain games, and the Adult Education Series, which you are attending today. The Adult Education Series brings experts in their field, like Gail, to share their expertise with you so that you have more information to tackle life's challenges and simply be more prepared for whatever comes up. Today's program, No Visiting Your Loved One, addresses the need for having an advocate when you cannot be with your loved one, whether it be due to a pandemic or distance. Our expert and presenter today, Gail Bick. Gail, you want to raise your hand so they know who you are? There you
Hi.
go. She's a certified senior advisor, a board certified patient advocate, and the founder and principal advocate for Intune Health Advocates. Today, Gail will review the fundamental tools and tasks of advocacy and propose ways to help your ailing loved one when you cannot visit or when you live in another city. Gail will also guide us in making the most of telehealth visits. We will be recording today's session to make it available as a podcast on our WISE website. So if you're a Y member, you'll be able to reference it down the road as well. If you're not a member of our Y, you can make a donation to the Y and have access to the podcast too. The Adult Education Series programs typically last an hour, and Gail will take questions at a couple different points during her presentation. If everyone could mute themselves during the presentation so that background noise doesn't interfere with Gail's presentation, you can then unmute yourself when she opens the forum for questions. Finally, if you would like to support the North Suburban YMCA and the Adult Education Series, we are happy to accept donations. Your donations will enable us to continue to keep all of our adult programming free and open to the public. Visit our website at www.nsymca.org if you would like to make a donation. Thank you for joining us today, and a special thank you for Gail for your time and your effort in putting together today's presentation and for your sharing your expertise with us. And I will let you take it from here, Gail. Thank you.
Thank you so much, Karen. I always love doing talks at the Y.
And we love having you.
Pardon?
And we love having you.
Thank you. So as Karen introduced me, I'm Gail Bick, and my business is Intune Health Advocates. I'm a private patient advocate, and I'll talk a little bit about that at the end. Normally when I give a talk, I like to start off by asking everyone, have you or anyone you know ever felt frustrated or overwhelmed or stressed out dealing with the healthcare system or health insurance? And Karen, I see Karen raising her hand. I can't see anyone else for some reason. And I've never had someone say no. And I think that's more true than ever during these past 10 months with all the changes that have gone on, and especially with the restrictions on visitors, both at doctor appointments and in the hospital. So really what I want to do today is talk about what you can do to advocate from a distance, talk a little bit about telehealth appointments, because that's been a big change this past year, briefly mention a couple key changes to Medicare policy that I think are important for people to know about. And then I always like to put in a plug for advanced care planning, which I think people have seen the importance of more than ever this past year. It really all comes down to preparation and communication. And that's true even without the restrictions and the rules that are going on during the pandemic, but it's even more so as a result of the pandemic. So I'm not positive that this is up to date. These the visitor policies change so relatively often, but the point of this screen isn't for you to memorize what North Shore is doing versus what Northwestern is doing. The point is to show you that it's different at every hospital system. And so I can't even give you like a rule of thumb about what to expect, because it just depends what hospital you or someone you love might be at and where your doctors are located. I have a friend who her mom had to have brain surgery at Rush a couple weeks ago, and she was allowed there every day from 12 to 8. Now, she was the only person allowed. You couldn't change who your designated visitor was, each day. So it was just her siblings, couldn't share in that. at North Shore, I know that they're not letting visitors on the inpatient units, but they let someone in the ER. And at Northwestern, they don't let you in the ER, but they let you on the floor. So it's just, it's sort of crazy. I don't know if any of you have had any experiences this past year with hospitalization, but it's pretty concerning, because I think we all know that when you're in the hospital, there's a reason, and it's really hard to be, alert and aware enough to keep on top of everything, to remember everything that the doctor comes or the nurses come in and tell you, even to remember to tell someone what your medication allergies may be. And you're tired, you're not feeling well, and it's really, in an ideal situation, someone is there with you. And the same thing's going on at the long-term care facilities. When the weather was nicer, people were allowed to schedule, 20 or 30-minute appointments outdoors with their loved one. And now that that's not such an option with our Chicago winters, there's a lot of isolation again. And a lot of, I think everyone knows the long-term care residents and staff are in the process of being vaccinated, but they're not there yet. And I'm really curious to know, I haven't seen this yet, when everyone's vaccinated in those facilities, will these visitor restrictions be lifted or eased at least? And I think we're all just waiting to hear about that. So, one thing I just want to point out is that if someone has some kind of cognitive impairment or disability, then there should be a way to get an exception to allow them to have someone come visit them, to be with them in the hospital. And you may have to go sort of high up to do that, but I totally recommend, trying to do that politely, always politely, not screaming at anyone, because our healthcare workers are under enormous stress. And, the person you're talking to may not have the authority to make an exception, but if you, go higher up, you may be able to get that exception. So the real question is, if you're alone in the hospital, are you going to be able to speak for yourself? And is there anyone else who knows enough about your health who can speak for you? A lot of times people will say to me, well, everything's in my electronic health record. But what if you aren't at your usual hospital? The electronic health record systems are supposed to be able to interface and talk to each other. But as with technology, things don't always go smoothly. So it's really important to do some preparation in terms of getting things organized in advance. So I'm going to stop the screen share for just a second so you can see me again. Am I back? Okay. So I recommend taking some time to make a binder or a folder, whatever works for you. I call it in case of emergency kit or a health information binder. And in this binder, you want to have a notebook, pens, and if you're really organized and have different tabs, you're going to put a bunch of information in here. And let me go back to the screen share so that you can see. Okay, so the next slide is going to list what information should be in here, but you want to make sure somebody knows where this is. It's not good enough to put this together and then nobody knows that you have it. So think about who you want to tell that you have this binder and where you want to keep it. In addition to the binder, you might want to have a bag ready. I kind of joke that, back when I was a lot younger and when I was pregnant with my kids, and you had to have that bag ready in case for when you went into labor. This is, something along those lines. But here you're going to put, if you have hearing aids, you want to put extra batteries in there, or maybe an extra set of hearing aids, or extra reading glasses, or your regular glasses, a phone charger, and even an extension cord so that you can always keep your phone plugged in and have it next to you. We'll talk a little bit more about your phone because your phone is critically important when you're in the hospital alone. And then if you want any toiletries. So in the binder, you're going to want to have a page with some personal health information, your date of birth, what your allergies are, the names and contact information for your emergency contacts. You're going to want to have your health insurance information, a copy of your cards, or at least write down the policy number, the phone number of the insurance company, your medication list, the name of the medication, what it's for, the dosage, the schedule, and your pharmacy name and number, and any medication allergies. And it's really important to keep that up to date. Your list of all the healthcare providers that you see, some login information for your patient portal. That would be important for whoever you designate as your contact person, if they want to be able to go in and check any previous tests that you've had, or be able to reach one of your specialists and message him or her. They have to be able to get into your patient portal. So who do you trust to have that login information? A summary of your medical history and your health status. And I'll show you some examples of what I mean by that. You don't have to have a copy of every test you've ever had, but think about what are the most important tests from your medical history and have that information in your binder. And then your advanced care directives, a copy of your healthcare power of attorney form, your living will, your DNR, any information that you have in there. And again, a lot of this should be in the patient portal, my chart if you're in part of Northwestern or North Shore Connect, but it just doesn't mean that everyone will be able to have access to all that information. You can have a HIPAA release form so that the hospital staff know who they can talk to and who they can share information about you. And as I said, a notebook and some pens. So your health history would be a brief note. It could be bullet points or a small paragraph. And what are you currently being treated for? What past illnesses or surgeries are really critical for a doctor to know about, or what family history? Do you have any implantable devices, a pacemaker, because then that's going to affect if you have to have any imaging. Do you need a walker or a cane? Hearing issues, eyesight, cognitive ability, something that a doctor, the hospitalist, or a nurse can come in and really briefly look at and get a sense of who the person is and what their needs may be. So these are examples. Mary has Parkinson's and needs her medicine every 2 hours. The medicine is in her bag and she can walk a long distance with a rolling walker. That gives a bit of a overview about some important points, like in the second example that Sam needs a cane in order to walk. These are things that are important because you want to really be thinking about not preventing falls when you're in the hospital. So that these are just examples of how you can write up a brief summary. Okay, so that's preparation. Communication when you're trying to advocate for someone who's in the hospital by themselves. It can be, let's be honest, if you're there in the hospital, communication can be challenging, right? You don't know when the doctor is going to actually show up. Sometimes it's hard to track down the people who you need to talk to. And now you're doing it by phone, basically. And you lose all the body language, the facial expressions, all those cues that you normally have in person. So you want to designate someone in advance who's going to be the contact. the staff at the hospitals are completely overwhelmed, and they're not going to take calls from the spouse and all three of the adult kids and some of the grandkids. They're only going to take calls from one person. So you should think about and talk to your family about who that person will be, so that there's no fighting or confusion, if you're in this situation. You're going to want to ask someone in the unit, the nurse, what are their communication protocols? Is there a certain time of day that they want you to check in every day? Who do they want you to ask for? Who's going to be your point of contact there? And you want to have all the information that you need. That's why this binder is so important, so that you can advocate for your loved one if you're doing it from a distance. You need to know what the allergies are, what their medical conditions are, what other doctors might need to get involved. You can't really do a good job of advocating if you don't have all that information. So just making sure that you have everything that you need in advance. Along with the communication protocol, you want to try to get a sense of when the shift changes are, because that's generally not going to be a good time to call. But you might want to check in at each shift. So generally it might be 7 a.m. to 7 p.m. and 7 p.m. to 7 a.m. So who are you going to talk to at each shift? And then you also want to try to get a sense of what the medication schedule is. When hospital patients are getting their medications, that is a time when errors can happen. So ideally, if you're there with someone in the hospital, you're going to ask, the nurse before they start giving the medication, what medication is that? What is it for? And you're not going to be there to do that, but you still want to have a sense of what the schedule is. So maybe then you're checking in with your loved one and asking, did you get your medication? I know you were supposed to get it at 3 o'clock. Did that happen? You also want to, get a sense of what their pain levels are, so that you can stay on top of the pain management, and the pain medications for someone. I mentioned technology earlier, and it's just so critical. And I've worked with a lot of clients who are older, where I've spent time teaching them how to use FaceTime, if they have an iPhone or an iPad. And I just really encourage everyone to make sure that they know how to use FaceTime, or if you have an Android, a different app that works for that, and practice it. Make sure that you know how to use it, because when the doctor comes in, when they're doing their rounds and they come in to talk to you, you're going to want to try to get someone on FaceTime to listen in. And you can do that on the phone, but I think it's just helpful to be on video. There's something about seeing each other that helps with the rapport and helps with the flow of communication. And also that person can kind of have a look at you and see how you're doing, and express any concerns that way. But I really, really want to stress how important it is to be able to use some kind of video technology on your phone or your iPad. Another really important time for communication is during discharge planning. Now, the hospitals seem to be allowing someone, at least most of them, they seem to be allowing someone to come in on the day of your discharge and be there for the discharge meeting. So the discharge meeting takes place with the discharge planner or the social worker. And that is, whether you've been in, had a visitor or not, that is just another key meeting there, because the patient, what I find is the patient just wants to get out of there. They've been in the hospital, they've been woken up all around the clock, they've been in a bed that's not comfortable, and they just want to go home. But there's a lot of important information you get at that discharge meeting. And so you need to have someone there with you. And hopefully, even with the visitor restrictions, you could be allowed in for that meeting. But if you can't, again, you got to, do it, using some kind of video platform like FaceTime, and take notes. You really want to understand what medication changes have happened, what signs and symptoms the person, if the person has certain symptoms or certain things happen, what should prompt a phone call to the doctor, and what should prompt calling 911 or just getting back to the hospital immediately. It is really important to have an understanding of those signs and symptoms, that would be of concern. And also, you want to make sure that you understand what the person might need at home to help them with their recovery. Do they need a hospital bed or other equipment? And then, making sure that if that seems like it's going to be an issue, that you work with the discharge planner even, earlier during the hospitalization, because supply chain issues are going on everywhere in every kind of business. So you just want to be, up to, thinking ahead and proactive on what the person's going to need once they're discharged. I know of one person who advocates, like if you're familiar with the whiteboard that you see in the patient hospital rooms, an advocate I know developed her own whiteboard at home when her husband was in the hospital, and she wrote down, the shift changes and the names of the doctors and what nurse was on duty and his pain levels and what medications he was on and all her questions. And she just kept that at home. And she would look at it when she was on the phone with the doctor or the nurse or with her husband. So, whatever format works for you, it's just important to have some kind of system where you're keeping track of all the information, so that you can just be on top of it. And also when you call and when you get these daily phone calls, they don't have a lot of time. So you got to just really be on top of what your questions are and what information you want to share. So I just want to stop right now for a moment and ask if people have questions, if anyone has an experience they want to share that they think would be helpful. Any questions?
I have a question.
Okay. I can't seem to get my view to be different so I can see everyone.
Oh, I'm sorry. It's Karen.
Yeah.
And my question is, I have a friend who is now in a skilled nursing facility, and she has told me that someone, I'm not sure who they have taken away her cell phone, so she can't call anyone. So I don't know if her kids did, or if like they couldn't charge it, they couldn't reach it. And I'm wondering, like, whenever I talk to her, I try to tell her things that she should do, but I am not the primary advocate for her. Do I need to just let it go? Or should I push her to fight to get her cell phone back? Or like, I'm in an awkward position because I'm not her child, but she's a good friend of mine. And her kids aren't. Like, I don't know her children. Do you think I just need to bite my tongue and just let her figure it out herself with her kids? I know they're advocating for her, but.
And you don't have a way to contact her kids?
I do, but it's not necessarily I don't really know them all that well.
Right. I mean, if you're comfortable, I would say maybe a quick phone call or email saying, hey, your mom mentioned that she doesn't have her cell phone. Do you know anything about this?
Okay, that's a great way to put it. Okay, and just sort of.
Yeah, and then if it was them that took it away, you're not saying anything accusatory.
Got it.
But I feel like, God, the cell phone is such a lifeline right now.
Yeah, and she's a flip phone person, so she doesn't have a smartphone, so she can't see anybody anyways. But at least to be able to call me back, you know,
Right.
or to call her friends, it would be nice. Okay, thank you. That's a great
And
way
it
to do
may
it.
be the charging issue,
It
because
could be.
that's been a problem.
Yeah.
Um, I had a client who was in skilled nursing for rehab back in the spring, and getting them to charge his phone was a challenge.
Yeah. Yeah. I mean, I'm sure they're tapped, and this person is in quarantine, not with COVID, but with something else that
Yeah.
she needs to be quarantined for. So I get that the staff is completely taxed, but that's a nice way to put it. I can just check with her kids. I'll do it that way. Thank you. Good
Yeah.
advice.
And I want about the staff. I mean, at times, I think we've all experienced some frustration that maybe they're not responding as quickly as we'd like, but they are really overworked
Yeah.
and often short-staffed. I had a nurse at an assisted living community tell me back in November. So think about it, November wasn't even as bad as it is now.
Yeah.
And she's someone I've talked to often because I have a client on her floor. And so when I called and I said, "Hi, Agnes, how are you?" thinking I would just get fine in return. Instead, I mean, she just went off, not at
Oh,
me,
yeah.
but
Right.
because I happened to be on the phone with just talking about how exhausted they all are,
Yeah.
that every resident has declined in the
Oh,
last few months,
yeah.
and that without the family being allowed in to help them, the place hasn't hired any additional staff.
Right. And they can't, you know, they're
Yeah,
not bringing in more income. So yeah. Oh,
right. If
you're right.
anything,
You're
it's
absolutely
less
right.
income because I think more people are staying put at home if they can.
Right. Yep.
So there's not more staff, but everyone has more needs,
Exactly. Yeah.
and
You're
it's
Yeah.
right.
frustrating.
Yeah.
I met this
Can I
client
ask you
yesterday at the doctor and his hearing aids weren't in.
Oh,
And I just thought, oh my God, they let him leave without his hearing aids, and
right.
they knew he was going to a doctor appointment.
Oh, yeah. That's
But
so hard.
I also have to remember they're very overworked
Yep.
and quite worn out. And
Yep.
this is a high-end community.
Yeah. Yeah. That's where my friend is too. All right. Debbie had a question too.
Okay.
Yeah.
Debbie?
Can you hear me?
Hi,
Yeah.
Debbie.
Hi, Gail. How are you? This is great. I think the issue of staffing is, my question is basically, how do you advocate? Because a lot of places do not have adequate staff, and people's needs are increasing. So, is there a channel to call up the administration of a hospital or a nursing home and say, if you don't have enough staff, you can't take care of people?
I don't know about for that message, but
Yeah,
certainly,
okay.
If they know that you're keeping tabs on someone and you're checking in often, I think it's often like a squeaky wheel gets the grease kind of situation.
Uh-huh.
But it does require just a bit more patience on all parties. But
Mhm.
if there are real safety or health concerns, then certainly going up the chain is a good, is a necessary thing to do.
But who would you start with?
Well, certainly in a hospital, I would start with the unit supervisor, the nurse who's
Okay.
the manager for the unit,
Okay.
and then move up from there.
Okay. Thank you.
So I'm going to move on to talk a little bit about telehealth, and I don't know how familiar people are with it at this point. I feel like so many, like if this survey had been done in 2019, the numbers who had a telehealth visit would have been so much lower. There's been some real advantages with telehealth. I mean, it's, the obvious one is that you don't have to go somewhere and risk being exposed to the virus or to any other illnesses. A big negative is that the healthcare provider can't actually, conduct a physical exam. So it really just depends what the type of appointment is for. Some of them work really well, and other times, you just really have to go in person to get it done. But some of the things that people had raised in the survey was they weren't feeling as connected to their doctor. They were often having trouble seeing or hearing the doctor. And then not everyone has a private space to be able to do a telehealth visit. So those are all things to think about in advance, when you're preparing for the visit. And just so everyone knows, Medicare is paying for telehealth visits, and the provider can waive your copay or your coinsurance if they choose. And it used to be that you had to have seen the doctor in person in the past 3 years, but they've waived that. So you can have a telehealth appointment with the doctor you saw more than 3 years ago. On the other side, there used to be some pretty strict HIPAA rules, privacy rules about telehealth, and those have been relaxed, and that benefits the providers. So how do you prepare for a telehealth appointment? Sometimes you have to download an app on your computer or your phone, or whatever you're going to do that from, and so you want to do that in advance. You want to make sure whatever device you're using, you've charged it. Close all unnecessary programs. Karen and I were talking about lighting before everyone else came on, and lighting is pretty important for telehealth, because especially if you want the doctor to see you, or if you're trying to show them a rash or anything on your body, or even just to kind of get a sense of, do you look pale? So you want to think a bit about the lighting. You want to have a quiet space. You want to try to log in early so that you can troubleshoot if you have any difficulties. And then have a phone number handy that you can call if you can't log in, or if you're having some kind of trouble. It's just important to know, like, who will you be able to reach. So while some places use an app, other times you're emailed or texted a link that you just have to click on. So you just want to have a sense of what to expect. How are you going to be able to go on the telehealth? So like, one of my clients has a telehealth appointment tomorrow with a new provider, and she should be receiving an email today with a link for her to click at the time of the appointment. So it's just important to know that, versus whether you have to download an app, or whether you're going to get the link that day. Because I think people often have a lot of anxiety. They want to know how are they getting on to this appointment. So it's okay to ask that when you make the appointment. And then, it's really the same as if you're doing an in-person visit. You want to, prepare your agenda, with your list of issues and questions, have your medication list handy, have your pen and paper. If someone can sit with you, then they can take notes. And I always like to remind people that it's a good idea to repeat the instructions back to your provider, before he or she leaves the room or the video, because that gives the provider an opportunity to correct anything that maybe you didn't understand, and to make sure you understand what the next steps are. If you're going to need to provide any info on vital signs, do you have a blood pressure monitor at home, or oximeter, what information might the doctor want from you, and is it possible that you can, that you have the equipment at home to provide that? So you can ask that ahead of time. And I think that more telehealth will be here to stay. As I said, at the beginning of this section, I think that it's been a real godsend in a lot of situations, thinking about people who aren't that mobile and maybe have needed a Medicare or Medivan to get to an appointment. You know, it can save money and time and a lot of difficulty in cases where there are mobility issues. On the other hand, we don't want to overuse it because there is something about the doctor seeing you in person that can't be replicated on telehealth. I think it'll also provide a lot more access to specialists for people. And I just want to kind of stop here and see if anyone has questions about telehealth appointments or even regular appointments during this time.
I have to agree. I've had telehealth visits that have been phenomenal. It's Karen again. And very, very helpful. So, you know, there are, like you said, there are situations where they're good and situations where maybe not, but they've been very beneficial.
A couple months ago, I had this like cut under my eye that got infected. And I took a picture and sent it through North Shore Connect to my doctor. I said, I'm concerned that there's streaking, which if people don't know what streaking is, when you get those red lines, you know, that can't come from where a cut is. And that's a really dangerous thing if you get streaking with an infection. So she responded within 10 minutes and said, I need to see you today, but we can do it by telehealth. And so we did. And I was like putting my face way up to the camera and she could look at it and she, you know, wrote me a prescription. Wow. And it was super easy. I didn't have to go in and I got exactly what I needed.
Yeah, that's great.
You know, but then I've done appointments with clients where it's an oncologist and, you know, that's a lot harder to do on telehealth.
Yeah.
You know, you're talking about some, you know, much heavier issues than an eye infection.
Right. Yeah, for sure.
And I think what I've seen is that the doctors have gotten so much better at telehealth since the spring.
I was on Fiverr because
Oh, good. Great.
There were some real difficulties at the beginning, but they seem so much more comfortable with it, and the health systems have just, you know, really made the technology piece easier. One thing that's still challenging that I meant to mention is if you want to have someone else participate, so, you know, from another location, that still seems to be a challenge with these systems.
Well, hopefully that will get better, you know, because certainly these things, you know, I've had presentations where my presenter was in Florida. The person putting up the presentation slides was in Massachusetts, and I was here, and my attendees were here, and it all worked. So hopefully telehealth will get better.
Right, and we all know we've all been on those kinds of Zooms where it works, but somehow with the telehealth, I think it has to do. My guess would be more with the HIPAA issues. Like
the security.
They send only the patient the link, and then the link may not work from multiple devices. But there are a lot of situations we can all think of where you want someone else to be part of that. And so you have to ask in advance, like, is that an option? And if it's not, I mean, one time I had the person FaceTime me while they were on their laptop with the doctor, and we made it work. Yeah. You know, but it would have been easier if I could have just been on the appointment too.
Yeah. Well, hopefully, like I said, hopefully they'll start to do that because they're realizing that, you know, obviously they have to follow the HIPAA rules, but there have to be ways for people's advocates to be involved. And that's, you know, that's why this presentation was so important. I'll go right into my thank you, Gail.
Wait, I got a little bit. Do I have a little time or no?
Oh, yes, absolutely. I thought you said you were done. Yes, absolutely.
Okay. So there's been a lot of policy changes to Medicare, and those are as of March 1st, and it's until the public health emergency is lifted. So there's like a 33-page guide of all the changes. I am not going to go through all of those. I want to just point out a couple things. If someone's in the hospital and then there's a need to quarantine, those extra days should be covered by Medicare. And really important, people may or may not be familiar with the 3-day inpatient hospital stay rule that was in existence. So if you wanted if you needed to go from the hospital to skilled nursing or rehab, in order for Medicare to pay for that skilled nursing stay, you had to have been in the hospital for 3 days as an inpatient. And that has been waived since March. So now you could be in the hospital for 1 day, go to skilled nursing, and Medicare is going to pay for it. And that's a really, really important change. And there are a lot of us who hope that that stays because it shouldn't be dependent on the hospital being willing to keep you for 3 days. Also, Medicare pays for up to 100 days in a skilled nursing facility. And if you need more than 100 days and it's because of a COVID situation, and that's really fuzzily defined, then you can get an extension beyond the 100 days. So just important to know. And I just want to mention that in the skilled nursing facilities, that they're just not doing the same kind of surveys and infection control surveys that used to be done. And that's certainly a concern for people who, advocate for people in skilled nursing facilities. So it's just something to be aware of, that is not going on at the same level that it was before March. And there's been changes to home health, Medicare Part B, the vaccine. So this slide was from a few months ago before the vaccine came out. That's why it says when available. We all know it's available now. That vaccine is covered by Medicare Part B. And I hope everyone will be able to get it soon. If you're not signed up, I don't know where everyone lives here, but if you're in Lake County, you need to be signed up through the Lake County Health Department All-Vax site. If you're in Cook County, the Cook County Department of Public Health has a sign up, site as well. I would also recommend checking with your doctor's office if there's any signups, in case that the doctor or the hospital, the healthcare system gets vaccines that are going to be released to the public. How are they going to notify people? My mom was at her doctor last week, and he said she should be checking the MyChart portal pretty much every day, because if there are any doses available, they may just put it out there that way. I hadn't heard that officially from anywhere, but that's what my mom was told. Walgreens and CVS right now are only going into long-term care communities to give the vaccine. In some states, you can sign up for a vaccine through those drugstores, but I don't believe that any in Illinois are doing that at the moment. I've also been looking into whether the VA is having any kind of registry for people who are veterans. So if that's going to be another option, but I don't have the answer to that as of yet. There's some changes with Medicare Advantage plans that benefit the provider as well. I mean, not the beneficiary, sorry.
And can I interrupt you 1 second, Gail? It looked like Gloria might have had a question for your, Gloria, we need you to unmute. Do you know how to unmute? I think she might have had a question for one of your slides, so that's, okay. I hope you don't mind, but.
No, I'm happy to take it.
Okay, thank you.
Yeah, Gail, how would you access the 33-page guide for the Medicare changes?
It is.
Oh, okay.
That's the long link.
Yeah.
But it's basically through the Center for Medicare Advocacy.
Karen, will you be able to send us that?
I'll send it to you, Karen.
Yes, absolutely. And I'm taking a picture of it right now as well. That would be great, Gail. If you have it to send, that way it'll just be an easy link and I won't get any misspellings done.
Okay,
so thank
yeah,
you.
I'll send it to you this afternoon.
Terrific,
Okay,
thank
great.
you. And I'll send it to you, Gloria.
Thank you so much.
Thanks, Gail, very much.
And then with Part D, people may know by now that, you can get refills up to 90 days, even if it used to be 30 days. And there's some restrictions on, the mail and home delivery. And then there's changes with appeals and hospice and medical records and all this. And it's just too detailed and probably boring to go through all of it. Any questions about Medicare and COVID? What just happened?
It looks like your screen sharing changed.
Yeah, okay. It's like
There you go.
my Adobe started doing an install.
Oh, geez.
Okay. I hope people have done advanced care planning. I always try to throw this into my presentations because it is so critically important to take time in advance, you know, when you're not in a crisis situation. So if you haven't filled out a healthcare power of attorney form, please, please, please do so. I can send Karen this link as well. This is for the official Illinois form. And then don't only fill it out, but make sure the person who you designate knows that you've designated them, and take some time to talk to them about what your wishes are. And the 5 wishes document, which you can get from 5wishes.org, that's a really nice workbook that it does have a power of attorney form. And then it has different pages that give you scenarios where you can answer what you might want in those situations. And then it also even goes on to like your preferences. You know, what kind of music might you want played? Would you want to be massaged? You know, like, you know, from little to big. And it's a really good way to have the conversation, because it's a difficult conversation to have. So if you just kind of go through this 5 wishes booklet page by page, it guides you through that conversation naturally. So that's nice to do. And that can really serve as your living will, but, you know, also make sure you have the conversation with your doctor about, you know, a DNR order or a POLST is physician ordered life-saving treatment. And that can only be done by a doctor or, you know, a provider. And that's for people who have, you know, serious medical conditions. Not everybody would have a POLST. That's, you know, if you have cancer, advanced heart disease, something like that, then you would have a POLST that you would fill out with your doctor. MyDirectives.com is a website and an app where you can store this kind of information and easily, you know, in a cloud-based system and share it with whoever you need to do. And then I just put this question, like, you know, some people have changed their wishes during the pandemic from, you know, all the talk, especially early on, about what it was like to be on a ventilator and what the recovery was like, gave people a lot more information than they had in, I hate to use a trite phrase, but in normal times. And sometimes people were changing their living wills based on the information that they learned, or maybe they wanted something specific if they got COVID and ended up in the hospital that might not have applied in another situation. So again, just good to take time to think about, you know, what your wishes are and if the COVID situation has changed anything for you. Any questions about advanced care planning? Okay. And then just, you know, briefly, as a private patient advocate, I help people with a whole host of issues. I personally believe that most of the problems that we have in our healthcare system are about poor communication and coordination. You know, like the doctor and the patient not really understanding each other, or if you have a lot of specialists, the doctors aren't talking to each other, or your family members aren't really informed about what your needs are, or you don't have all the information that you need to make good decisions. So, you know, my goal is to really help with all of that. I help people prepare for their doctor appointments. I accompany them. I help them with the transitions, with understanding their diagnosis, with insurance issues, appealing a denial, troubleshooting, you know, sometimes there's coding errors. I help people negotiate bills with providers, and, you know, some of these other bullet points as well. So anyone has questions, I'm happy to answer about this or about anything from the presentation, or if anyone even has a random question about what's going on with the healthcare system these days, I'm certainly up for trying to answer it.
So you do all the yucky things that people don't like to have to deal with when it comes to healthcare. I've never seen that list that you have of all those different things. It's all the tough stuff.
Especially a lot of people don't like to deal with the insurance and the billing stuff.
Yeah.
Like even other advocates or geriatric care managers, and I do that. I've saved people tens of thousands of dollars at times.
I'm sure. Yeah.
And there can be a lot of follow-up from doctor appointments. I was with a client yesterday, and there was a whole list of things that someone had to do after, and he has vascular dementia. He couldn't have done it on his own.
Wow.
So.
Wow. Well, once again, thank you on behalf of all of the people whom you help. I hope you get thanked a lot, because it really is. It's a hard job for you. It's a hard job. Obviously, you enjoy doing it, but it's not an easy day-to-day.
Yes, indeed.
There are things that are challenging, but I often find that when you're not emotionally involved, and that's not to say that I don't get emotionally connected, with the clients, but when you're, on the outside, it's often can be easier to process everything and not get as upset, and when you're talking to the providers or the insurance people or whoever that you need to talk to, there's, when you don't have that emotion coming into play.
Yeah. I think maybe you're thinking like personally invested.
Yes.
You're not personally invested. You're still emotional about your people, but you don't have that personal, I was at that, whatever, yeah.
Right. Like I have a client who works for an insurance agency, and she helps their clients with insurance stuff, but she called me to help her because she said she was screaming at the insurance people because she was so upset, and she could see that like she shouldn't be the person handling it. Because you know what, not that you can't get very assertive or aggressive when you need to, but you do better when you're not yelling at someone.
Yeah, definitely. Most definitely. Oh, great. Does anybody else have questions?
I have one question, Gail.
Hi, Debbie.
Yeah, hi. Sorry, it's Debbie again. You're not a geriatric care manager, right? How do you distinguish the work that you do from a geriatric care manager?
That's a good question.
Yeah,
and people ask that all the time, and there's a lot of overlap. I'll say that. There's a bit of a different, I think, philosophy about, I tend to be more goal oriented at times with what I'm doing. I'm not just, I don't know. There's roles for each. I'm more focused on the advocacy than the day-to-day. Well, that's not necessarily always true either.
Yeah.
One big difference is I don't think the care managers like doing the insurance and billing stuff, because I've had a couple of them refer those cases to me.
Okay.
But they often tend to, I think, kind of have like maybe a regular weekly meeting with their clients and go over activities that they're doing and socialization, for example. And I am a bit more focused on the health component, the doctors, the both of us would identify resources, and support. So.
Okay. And what would you say?
Anyone who has a good answer to that question.
What's been the response from doctors? Do they generally welcome your presence
Very
and involvement?
positive.
Okay.
Very positive.
I wasn't sure.
Yes, I have yet to run into a doctor who wasn't positive. Like when I explain what I do, and they're like, "Oh, this is great." And one doctor said to me, if all my patients came in with someone, whether it was a family member, a friend, or an advocate, he said, I would save an hour to 2 at the end of every day from responding to the emails and phone calls that I get later.
Great.
So,
That makes
Very
sense.
helpful. Thank you.
I have another question.
okay, Gloria.
Yeah, Gail, if we wanted to contact you, how would we reach you?
I can, if
I
you
can
want,
send you
when
that as well if you want.
I can send that to Karen to have her send out to everyone, but I can, if you want a phone number or an email address, I'm happy to share that. My number is 847-920-8238.
And I just plugged it into the chat as well. So I will send that to everyone.
Oh, okay.
So that's
great.
Gail's phone number, 847-920-8238. Did I get that right?
Yep.
And
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 where
I'll
are you?
send you all the links that I had in the PowerPoint. And if you want to forward that email to the participants, then they'll have my contact info.
Yep,
That'll
yep.
be
So if you
great.
registered, I have your information. If you did not register and you would like the information that I'll be sending out, send me an email address, an email, and I'll give you my email address again so that I can send it to you. There you go. That's me. So, but Gloria, I know you've got my information. Debbie, I know you were here too.
Okay.
And Lori and Carol, I'm not sure, I can't remember if both of you registered, but if you did not and you would like to receive the information that Gail gives to me, I will then send it on to you as well. So,
Okay, and Gail, where are you located?
I'm in Deerfield. Are
Mhm.
you in the area?
Yes, yes, I am. Mhm.
yeah. And
I
she's
know
great.
Karen was
Victoria.
saying that they have people zooming in from all over the place now.
Right, yeah, yeah, because they put it in the newspaper and yeah, so anybody can go to anything now,
Yeah, it's really
which
great.
is good, yes.
Yeah. Yeah, it really
That's
is.
a
And
plus.
you could,
We keep trying to find the pluses of the past year.
that's right. That's definitely a silver lining for sure. Yeah.
Mhm.
And I think we will continue to do the adult education series. We'll always have this video component as well. Because even when we
Great.
do it back at the Y, if you've gone out of town, but you want to attend a presentation, it'll be nice to be able to do that. And it's not hard. I go to teach a class at the Y and I bring my computer with me and I set it up and I teach my class and people can do it in the room or from home. So yeah, there are definitely some silver linings to come out of this as long as we all get through it.
Yeah, and I want to encourage you, if you haven't signed up in one of those vaccine registries, depending on where you live, please do so, because that's how they're going to contact you to tell you when it's your turn.
Yep, exactly. Thank you, Gail. That's a good point. I signed up through Cook County, but it's just information right now. It's not a registry like Lake County has, as far as I understand. I believe it's just to get information.
That's what I've been hearing. So Lake County, my daughter is a essential worker, and she got the email about 2 weeks ago, and then she was able to go in and get her vaccine, and that's how she was notified.
Gotcha.
'Cause she
That's
signed
great.
up.
Yeah. Yeah, they're trying. I work with someone who works with Cook County, and she said they're trying to put someone in place who is more of a, I'll say a planner, sort of almost a supply chain person, because the people who were in charge of distributing the vaccinations were medical people.
Mhm.
Just, that's not the way they think. They're not in that type of an organizational role. So they're putting someone in who has more of a role in, has more skills in that setting.
I saw a funny meme last month that said they should hire all the out-of-work event planners
Yeah,
to run the
Oh,
vaccine
yeah.
distribution. Because everything
exactly.
would be color coded. There'd be like cocktails and light buffet while you're waiting. That part was a joke. But seriously, like I've volunteered at some of the Lake County Health Department clinics, and the first day I was there, where there's some organizational issues that ended up having people waiting in their cars for an hour and a half to 2 hours. It was a drive-through clinic. That was the first day they used the computers to do this. And I mean, it was crazy. It was absolutely crazy. But then they got it resolved, and now like you're in and out.
That's great.
It's very quick. But yeah, you could see where like that event planning would really come in handy.
Yes. And who planned for this? No one.
Right.
So,
Right.
you know,
And that's not the skill of the health department.
no, and which is good because they're the ones, you know, they have other roles and they do a wonderful job. But yeah, you're right though. If having the event planners do it would have been fabulous and given them work.
Right.
So
Right.
yeah.
So yeah, I mean, and I just also tell people like be patient with the health department. They in the best of times they don't have enough funding or staff. And then this past year they've had testing added to their plate. They've had contact tracing. They've had
Yep.
supporting the school districts and the hospitals and the nursing homes, you know, and all this other stuff. And now they're being told you're distributing the vaccines. And I'm confident that they haven't been given enough money to make that all happen.
Yeah.
So, I mean, there were a lot
I
of
want-
volunteers. When I was there were like 25 people, I think, working this clinic, and probably 20 were volunteers.
Wow.
So,
Wow.
I want to recommend a book I just finished. It's called Our Malady by a Yale professor. It's not a long book. You know, it's pretty accessible. He had a medical crisis and he went and analyzed the medical system. And I think this lack of funding and lack of excess capacity is built into the system. And so a lot of the failures that we're having now are really the result of the
yeah.
way healthcare is organized and paid for.
It's
So
called Our
that's a big
Malady.
piece of that. Our malady.
Okay. Yeah, I mean,
Timothy
even when you
Snyder.
hear about the fact that you know, in places where the hospitals are really at their max with COVID, that they're saying they could put more beds up, but they don't have the people. to
Right.
staff
They don't have the staff, right? Right.
Yeah.
And it's affecting everyone, not just COVID patients. I mean,
Everyone.
if you live in LA, you don't want to be having a heart attack or a stroke right now either.
No.
Right.
Yeah, and even if you don't live in LA, I mean, I'm sure you've seen it with the people for whom
Yeah.
you're advocating. It's affected every part of the healthcare system without question. You know.
Every single part. It's been a tough year.
It has. So stay healthy, everybody, as best you can,
Yes.
and stay strong.
Indeed.
Yeah.
Thank you very much for this program.
Yes.
I think it was very helpful.
Yes.
Thank you for registering and joining.
Yeah, Gail, thank you so much. She's wonderful,
Thank you,
everybody. And
Karen.
oh, my
Thank you,
pleasure. You
Karen,
know what, I feel so
for
fortunate.
organizing it.
Yeah, I have contact with some great people, and I'm really pleased. You know, Gail's been with us for a couple of years now, and she always has such a top-notch program. So Gail, thank you. Thank
For
you for
sure.
joined us
Thank
today.
you, Gail.
This was
Thank you.
fabulous, and we hope to have you back, Gail, and we will we'll just keep on trying to give you whatever we can to help you get through everything in life. Turn to the why.
Thank you,
All right.
Karen.
Thank you,
All
guys.
right. Thanks, everybody.
Thank
Take
you
care.
all.
Bye-bye.
Bye-bye.
Thanks, Gail. Bye-bye.
Stay well.
You too.